Appreciate the time, doctor. This procedure, in the grand scheme of things, is relatively benign, correct?
Absolutely. Number one, Mo, thank you for having me today. And number two, we need to understand what is, appendicectomy, right? So appendix is structure at the beginning of our large intestine that can get inflamed. And with the inflammation secondary to a blockage can cause infection. So obviously the procedure is going to be depending, the extension of this infection, right? So if you get a simple appendicitis, meaning that you have inflammation, it's pain, maybe nausea, vomiting, abdominal pain, and they cut it pretty early and you got a laparoscopic surgery. What that means is little poke holes, camera, instrument, you get the surgical procedure, easy recover. We're talking about 3 to 5 days, starting coming back to activities depending how you feel, and then moving on from there. If you have a more severe, injury, a more like an abscess formation, and there has to be, an open, procedure, then take a little bit longer. But you're completely right. It is no surgery is really simple, but if we want to keep it that way, it's a simple procedure. If we want to say one of the simplest one is a bread and butter for general surgeons, and they can get this done pretty quick and move on.
Let me just ask you this, for the sake of our listeners who have never gone through something like this before. I remember when I had it, I woke up in the middle of the night and there was this intense pain on my side, and it didn't go away. And I had known people who had gone through something similar, and so I connected the dots and had my appendix taken out, and I was good to go. What is the telltale symptom? If you're like, wait a minute, I'm dealing with the same thing Joe Burrow might have had, what is the telltale symptom?
Well, most of the time it's a right lower quadrant abdominal pain. So that means that, in your pelvic area, close to the abdomen, right side, close to the right groin, a little bit higher than that, you're going to start developing pain over that area. A lot of the time you can have nausea and vomiting. You can lose your appetite because, you don't feel right. If it's an infection, you may have fever, chills, and, not feeling right, feeling even flu-like symptoms. So people can be confused for a lot of other things, and we can miss it. The physical exam is hands-on. You have to be, really suspicious about it. It doesn't matter the age. You press in that right lower quadrant area and the abdomen, pelvic area, and the person jump off the table. It's severe, significant pain. If it's early, you may not have that more severe pain, but the longer that you wait, the more the pain can increase, and it's easier to diagnose.
So I remember having the procedure done, and I dealt with some discomfort, but I didn't miss work. I didn't really miss having to do anything. At the same time, I'm not playing a sport at the highest level, and I don't have men trying to tackle me. And so, what could be the complications, and ultimately, when do you know if you're ready for high risk physical activity after this procedure?
Well, we have to define, complication for the condition, for complication for surgery. I think the more thing that I will be worried about, if I have to worry about anything, most of the time it's infection of the incision site. This procedure is, like I say, it's bread and butter, is right there. You go in, you get out, remove the tissue, should recover pretty fast, especially if there's no abscess formation. There's an abscess formation that is a complication from the condition. You may have to put a drain on it. But if everything goes like, we expect and what we know about it, obviously we don't know everything, he should be, this could be mostly check that the incision looks heal fine. These are football players. They're on the field. At this time, they're not getting contact. It's the beginning of the, training camp. So it's more about how he feels, how his hip rotation, his mechanic, that he got the whole movement and feel good to start tossing the ball. You know how it is. You start tossing the ball with some type of discomfort. You start changing your arm slot. You start changing the way that you throw, and other things can happen. But regularly, I'll be worried about maybe incision site. Other than that, it should recover pretty well.
How long does any residual pain tend to last?
Person to person, Mo. That is, you said, you were playing cornhole, 5 days later or whatever time was, but that's pain perception. It's depend on the person. The way that they do it, you should be recover pretty quick. When you look about it, recommendation 3 to 5 days, laparoscopically. You look in the past, NFL player who had this, you get Matt Castle, who 11 days playing in the game. He's getting chased, he's getting tackled. 11 days later, how much contact he got before that, probably a little bit of contact, not too much to practice, but he was able to come back. There's another guy that I was looking about it, and took around 10, 14 days to be back. There's even a offensive line that played through it. You know what I mean? So these are things that is pain perception, and he's going to be honest. He's an athlete. He's smart. He's young. He want to play, but there's no rush. This is not going to Super Bowl week where you may push it a little bit. No, this is starting of the season, starting of the training camp. He's going to be honest about it. That's what we all expect as a team physicians, and he will be fine.
Awesome stuff. I appreciate the insight. OrthoCincy.com, the absolute go-to pros when it comes to not only my questions about medical procedures and sports injuries, but anything you're dealing with as well. Dr. Velazquez, this has been awesome. I appreciate the time, and we'll do it again. Thanks so much.
Thank you, Mo. Have a great day.
Here's my guy, Dr. Angel Velazquez, years as a team physician with the Reds, now with OrthoCincy, OrthoCincy.com, 12 locations, Southwest Ohio, Northern Kentucky, and Indiana. We go to PBS coming up in just about 15 minutes. Luis Castillo.